Okay, so Ella and I had Guillain-Barré syndrome and tetraplegia for our presentation. So what exactly is Guillain-Barré syndrome? It is an autoimmune disorder, so the person's own immune system will attack their peripheral nerves, which causes muscle weakness or even paralysis in the most severe cases, which, as you'll see with our case study later, they develop paralysis from it. It is quite rare. Every year in the United States, there's only about 3,000 people diagnosed with Guillain-Barré syndrome, so not a lot. It mainly affects feet, hands, and limbs. It causes a lot of numbness, a lot of weakness, a lot of pain, especially like that pins and needles sensation or like tingling. You'll feel that a lot. There are three different types of Guillain-Barré syndrome. So the most common seen, especially in the United States, this is the most common, is the acute inflammatory demyelinating polyradiculoneuropathy. I think I said that right. That's the AIDP. There's Miller-Fish syndrome as well, and then there's also acute motor axonal neuropathy is another type of Guillain-Barré syndrome. What causes Guillain-Barré syndrome? So not exactly sure, unfortunately. The exact cause is unknown, but we do know that develops after having infections. So a few days or some weeks after having a respiratory or digestive tract infection, you can develop Guillain-Barré syndrome. The most common infection leading to Guillain-Barré is the Campylobacter jejuni. Others include the flu, cytomegalovirus, Epstein-Barr virus, and the Zika virus. And I also found, just when we were looking for evidence to support interventions, I found some new articles saying that you can get Guillain-Barré after having COVID-19 now. So I thought that was kind of interesting, kind of relevant to us today. The progression of Guillain-Barré syndrome. It has a very rapid onset. Once symptoms start, it's usually the worst within 2 to 4 weeks. The symptoms can progress over hours, days, or weeks, so it can be very quick and kind of take a little bit longer. Kind of depends on the person. Most people with Guillain-Barré plateau at its peak, and then they actually begin to fully recover. So most people fully recover from Guillain-Barré syndrome within a year. So I think that's pretty cool. Only 1 in 5 people have long-term problems from it. So although we don't really know what causes it, can't really prevent it, it is usually recoverable. So that is good.
There's no cure for Guillain-Barré syndrome. There are some treatments that can speed up the recovery. The first one being a plasma exchange. This is basically when the blood is taken out of the client's body and then separating the plasma out of that blood, and then that new clean blood is put back into the client's body, and it's hoping that the new plasma that is being created will then help fight off the Guillain-Barré syndrome and speed up that recovery. And then intravenous immunoglobulin therapy, also known as IVIG, is when a donor is donating their immunoglobulins, which is just naturally occurring antibodies, and that immunoglobulin is then injected into the client that has Guillain-Barré syndrome. And this is just hoping to speed up the recovery process. The next treatment is a pain treatment, and this is making sure the client is comfortable throughout this entire period of their life, just because it is very painful. There is definitely a lot of times when clients are going to be struggling with their pain, and it is important to give them that treatment. There's no designated pain pill or medication that they should be taking. It's just whatever the physician believes is appropriate for their plan. And then there's also recovery treatment, which is occupational therapy, physical therapy, and speech therapy. Occupational therapy is just helping them get used to either like wheelchair mobility, bed mobility, and later on in life, maybe getting back to where they were prior to contracting Guillain-Barré syndrome. Physical therapy is just regaining that strength that they lost due to the muscle weakness. In speech therapy, if the client has if their facial muscles weakened through this syndrome, it is important for them to work with a speech therapist just to help increase their ability to talk and even eat. Some common deficits and how they impact the client's independency, the quality of life and function is now the next thing we're going to be talking about. So the first deficit is weakness in your legs and upper body. So this is going to be hard for them to complete tasks, which is going to be frustrating for them. Then there's also unsteady walking, which it's going to be having them have trouble from getting to A to B, which can also be really frustrating for someone who's never had this problem before, because it is kind of a short period of time where they would contract the syndrome. It's maybe 4 weeks. So throughout that 4 weeks, they're just kind of slowly becoming less and less able to walk. And that can be really frustrating for someone. The next one is difficulty with facial movements. Like I talked about earlier, this is swallowing and talking, which are very important for eating and communicating to our loved ones, which is kind of a really important part of our life. And then double vision, which is just difficulty seeing. You're going to be seeing 2 objects, and this can cause pain in your eye and even headaches. And it can be frustrating for someone who's never experienced double vision before. Some more deficits would be severe pain, and it does tend to be worse at night, which can impact their sleep, which is definitely something that we need a lot of. And it can also impact their daily activities because they might not be more open to going out and doing therapy just because they are in so much pain. There's also difficulty with their bladder control, which can be embarrassing, especially if the client is younger. They might feel like wearing an adult diaper at the age of 20 is not good or something along that lines. It might make them feel embarrassed and like stuff, but it's totally acceptable and nothing to be ashamed of. Heart rate can be increased during Guillain-Barré syndrome, and this just means you can't do any strenuous activities. You can also have low and high blood pressure, which means you can pass out really easily. So you have to be careful of what you're actually doing, and you can have difficulty breathing, which again, you cannot do any strenuous activities. And the strenuous activities could be as simple as just going to the bathroom. That might be too much for some clients. So now we're going to talk about our case study. This is Mike. He is a 38-year-old man who was diagnosed with Guillain-Barré syndrome. Prior to admission, he was completely healthy. He was self-employed as a landscaper, and he lived with his family. He had a wife and 2 children, and he enjoyed going out with his wife and friends on the evenings. 4 weeks prior to being admitted to the hospital, he did notice some sensory changes. They're all distal, and he felt like a little bit of tingling going on. But he also did experience some midline neck pains that kind of radiated out to his arms too. Once he was admitted to the acute care hospital, he had 2 rounds of IVIG, which is that immunoglobulin therapy. He also, within the 3 weeks of being in the hospital, his weakness did progress proximally throughout his entire body. And then once those 3 weeks were up, he was put into inpatient rehab where he had OT, PT, and speech therapy. And the main things that they were looking to address were irregular heart rhythm, him not being able to control his voluntary body movements, his incorrect swallowing patterns. He had low sodium levels, and he was on a feeding tube, and he even lost 20 pounds. So that was kind of the main focuses of the inpatient rehab. Hi, my name's Ella, and I'm in occupational therapy. Are you doing good today? Good. So I'm going to tell you a little bit about occupational therapy. So this is your first time having it. So basically, occupational therapy is just an evidence-based practice that's going to help you get back to where you were prior to your incident We're going to be looking at things that you like to do, things that you need to do, and things that you want to get done in the future. So today, well, first off, are you in any pain? Good. That's good to know. So first thing we're going to do is look at your passive range of motion. So this is basically you aren't going to move at all, and I just want to see how far I can physically move your joints. So we're going to be going up and back and bending your arm, twisting your arm, bring it towards your stomach, bringing it out to the side. We're going to be doing some of those motions. You're not going to do anything at all. I'm just kind of seeing how far I can move your arm. So let's begin. Let me know if you're in any pain at all. So first thing we're going to do, I'm going to grip your arm, and we're going to bend your arm. Don't help at all. It's just me moving as much as I can. Good. Now we're going to bring it straight out. We're going to bring it down. Now we're going to bring it to your stomach. We're going to bring it out. Good. Now we are going to twist your wrist. Good. Bend your fingers. Good. Good. Okay. Mike, so we are going to be working on your passive range of motion, and I know you were a self-employed landscaper, so I grabbed your plant from the counter on your windowsill, and basically we're just going to water it today doing that passive range of motion. So I brought a little watering can for us, and what we're going to do is I'm going to basically move your arm, and you are going to physically water the plant itself. Are you in any pain? Okay, so to begin, I'm going to grab your arm, then we're going to slide your hand in there, put your thumb on the top. Now we're going to lift, now we're going to tilt. Ready? Good. Good job, Mike. Now drop it, bring it down. Good job.
All right, so we're going to do another screen. This one's going to look at your ability to talk and produce words. Okay, so I just have some questions I'm going to ask you. I just want you to answer them to the best of your ability. Okay, so what is your name?
Mike.
How are you feeling today, Mike?
Teased.
Okay, what did you have for lunch?
Sandwich.
Good. How was your sandwich?
Furry.
Good. All right. All right. Hello, Mike. So I know you've been having some difficulty expressing with words what you want, especially when you're going out to restaurants with your wife and your friends, and even telling your nurse like what you want to drink in the morning. So I have this menu here, okay? And I want you to pick from it what you want to drink. Can you say it?
Apple juice.
Apple juice? Okay. So when the nurse comes in, I want you to repeat after me. Can you say, I want to drink apple juice?
I want to drink apple juice.
Good.
Okay, Mike. So it's been a few months, and so we're going to just kind of evaluate your strength and your muscles. I know you regain a lot of those muscles. So today we're just going to do a few little movements to see how you're doing. So can you lift your arm straight up for me? Good. Can you bend it like this? Keep going, keep going, keep going. Okay, good. Can you bring it towards your belly? Put your hand on your belly. Oh, good. Now can you try to bring it all the way out. Like you're grabbing this cup from the side table. Okay. Can you do that on your other arm? We're going to bring it straight up. Going. Okay. And then I want you to move your entire arm up. Good. Now can you bring it towards your belly? Now bring it out towards you grabbing that pillow. Good. Can you raise your shoulders up at all? Okay. Now I'm also going to have you point your toes. So point your toes. Go, go, go. Ooh. Okay, good. Now can you bring them all the way back? I'm going to try pushing on them. So can you push them back a little bit? You got good strength down here. Good. Now, I want you to push it against my feet. Ready? Go, 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 go. Okay. Now, can you lift your leg up at all? Okay, good bending. Can you lift your heel off? Like straight off the entire leg? Good. We're going to do that same on this leg. So lift your leg straight up. Good. Now, can you bend this knee at all? Okay, Mike. So we are going to be working on bed mobility today, just to help you be able to sit up by yourself. I know you regained a lot of muscles since you first came to the hospital. So we're going to be, basically today we're going to have you sit up off the edge of the bed. That's our goal. First off though, you are a little bit close, and this bed mobility does take a little bit of space. So we're going to have you scooch to the center. So first thing I want you to do, can you bend your legs straight up for me so your feet are flat against the thing? Good. Good. Keep going. Just a little bit more. Good. So I'm going to hold your feet, and I want you to put your hands flat on the bed and basically lift your butt up, and you're going to scoot your butt towards the center. So ready? Yes. Perfect. Go. Okay. Move your feet for me. Good. We're going to do it one more time. Good. Okay. You bring your feet down. Good. So, next, we are going to have you lift this right leg straight up. Do that for me? Good. A little bit more, a little bit more. Put your feet flat on the ground. Good. Good? Good. So now, take your right hand, and I want you to grab this part of the comforter. Move your arm for me. Keep going. Keep going. Okay, I'm going to help you out a little bit. Just kind of reach over there. Good. You did a good job. Now I want you to, on the count of 3, kind of swing your body. You're going to be pushing off with this foot and pulling with this arm to really move over. I'm going to help assist. You ready? 1, 2, 3. Push, 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 push. Keep going. Good. How are you feeling?
Good.
Good. Are you in any pain? Do you need a second? Okay. So we're going to have you sit straight up then. So first thing we're going to do is move your legs off. Can you move your legs for me? Keep going. Almost there. Almost there. Good. Now I want you to bring this arm up, and so your forearm is flat against the bed. Good. Now take your right hand and put it flat against the bed. Good. And now on the count of 3, I want you to push off with your forearm and your arm to try to sit up. You ready? 1, 2, 3. Good. Push, 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 push as much as you can. Good. How are you feeling? You feel good?
I'm tired.
Yeah, I bet. So, do you want to sit back down, or do you want to keep going? It's up to you.
Lay down.
Okay. So I want you to put your arm straight out to the side. Good. Now, we're slowly lean you down. Good. Now keep bringing your legs back up. Keep going, keep going, keep going. Almost there. Good. How do you feel? Good. Do you want to try sitting up in a few minutes? Again?
Maybe tomorrow.
Tomorrow?
I'm kind of tired.
Okay. So, tomorrow we're going to be working on getting you back up, sitting. And we're going to do that for a little bit longer because I know you got tired. It is a lot of work, and I get that. So, tomorrow, basically, we're going to sit up, and we're going to do a little bit of exercise to get you kind of up there, stamina. And then, hopefully, in the next few weeks, we can get you to be standing. Do you have any questions before I leave? It's nice seeing you, Mike.